An estimated 25 million Americans have asthma. Some of those people experience occasional shortness of breath, but asthma can be more serious and should never be ignored.
Asthma is both a nuisance for people that aren't breathing as well as they might be, and a very, very serious problem in that it can cause death. There are approximately 5,000 deaths a year from asthma, and the good news is most of these could be prevented.
Asthma is the result of a several-stage process.
Usually it's thought to involve three components: swelling of the airways, constriction of the muscles around the airways, and inflammation.
There is a broad range of symptoms that people can experience with asthma, from having intermittent tightness or wheezing when they perhaps do heavy exercise and being perfectly normal in between those periods, to having daily wheezing, tightness of the chest, difficulty getting a good deep breath, even disruption of sleep with difficulty breathing at night.
A typical asthma attack usually begins with coughing, maybe some shortness of breath or feeling of tightness in the chest, and then goes on to more obvious evidence of real difficulty breathing.
The causes of asthma are not entirely clear, but it does seem that there's generally a genetic predisposition. Once someone has that predisposition, the actual triggers of asthma are varied, but some of the common ones are cold air, exercise, infection, common viruses, irritants, and allergies.
Sometimes avoiding the irritation is all that is necessary.
Asthma can be very easily managed by an environmental modification. If the individual is only allergic to one or two substances, where they can be eliminated or significantly minimized in the environment. I'll give you an example of that. If the individual is allergic, let's say, to an animal that's indoors, taking that animal from the bedroom to the living room, or maybe more ideally to the kitchen or outdoors, eliminates that stimulus for inflammation, and therefore inflammation will diminish and the asthma episodes should diminish.
But often, avoiding asthma triggers is not possible. So in practice, asthma usually requires medical therapy.
Anyone who has symptoms of asthma needs treatment. It's a matter of whether they need it intermittently or something of a more preventative nature.
If it's to quell an attack, asthma medicine is called reliever medicine.
It's sort of like if you're prone to bleeding, you want to have a Band-Aid around, you know. If you're prone to wheezing, you want to have something around. These are generally what we call bronchodilators.
When the asthma is persistent, however, treatment is needed to control both the underlying cause, the inflammation in the lining of the airways, as well as the constriction of the airways.
Asthma is like a disorder in the lung, like people who have arthritis have a disorder in their joints. Their joints get hot, swollen, painful. Similar things are going on with asthma in the lungs. So we use anti-inflammatory medicines or controller therapies. There are several different categories of those, but the most effective and the most potent are the inhaled corticosteroids.
For people with persistent asthma, age 5 and above, federal guidelines call for the daily use of inhaled corticosteroids. There are 7 steroid inhalers approved for the treatment of asthma: Aerobid, Asthmacort, Flovent Rotadisc, Flovent, Pulmicort Respules, Pulmicort Turbuhaler, and Qvar. Doctors find patients are often alarmed, although unnecessarily, about the use of steroids.
If I ever say the word steroid in my office, I use the word corticosteroid. People are scared of the word steroid because there are muscle-building steroids that can be have serious side effects.
Steroids used to fight asthma are of a different type with much milder side effects. And the steroids taken by inhalation to treat persistent asthma are considered very safe, especially in low doses.
The good news is that the vast majority of patients who require treatment with inhaled corticosteroids do not require very, very high doses, and therefore are in a low to moderate dose category where the risks of side effects are actually very minimal, and the risk of good effects significantly outweigh the risk of side effects.
While the incidence of asthma appear to be on the rise across the United States, doctors say they have medicine to keep most cases under good control. That means less chance of a serious attack and a good likelihood that patients can go about everyday activities, even athletics, without any disabling shortness of breath.